Hey guys, welcome to another episode of the Beauty Pop Podcast. I'm Victoria.
And I'm Jen.
And today we have a very, very special guest. I've been so excited to have Dr. Jim Del Rosso on with us. He is a fabulous dermatologist. He's based in Las Vegas and originally from New York, because, you know, I have to give a shout out to the East Coasters always. Even though he migrated west, which is kind of my dream as well. Jen, you know, as an LA girl, I'm like this close.
Come visit.
Absolutely.
But you got to be careful, Victoria, because these people do things like put pineapple on pizza and stuff like that. It's just like,
I know. That is true. That is true. But Dr. Jim, that's why you're there to set them straight.
And I keep telling them, what do you mean oat milk, almond milk, soy milk?
We're having a lot of deja. Jen and I actually used to work with a dairy farmer, and that's what he always used to say as well. So you just gave us major vibes. I just can't, like, what's this drink, kombucha? It looks like bile. Oh, kombucha.
You know? My granddaughter, it's like,
it's
what is
good.
this
Have
stuff?
you ever had it?
I can't do it.
Oh.
Can't do it.
It has a pungent sort of flavor, but it is supposed to be really healthy for gut health and all that. I don't mind it.
My gut's doing fine as long as I have good lasagna and some great meatballs and stuff
nice.
Like that. You know?
You're making me hungry.
There's a restaurant in Vegas. It's on the strip, but way far down on Las Vegas Boulevard. It's called the Bootlegger.
Yes.
Dennis Bono and Lorraine Hunt. Do you know those people?
I know
and do you
the
know
place.
that restaurant?
I don't know them.
That is, I'm telling you, that's some decent and good, actually not decent, delicious Italian food. We'll have to meet
am going to have to check it out because it's hard to find here. You know, we're all brought up on how grandmother made the sauce, and that's the taste that we get accustomed to. So if we go to someplace else, because there's a lot of different varieties of how it's done. Everybody has a grandmother that did it a certain way, and whatever taste you got accustomed to, if the place you go is close to that, you like it.
Sure. Well, it's comforting.
It's not, it's like, yeah, it's okay, but because it's what you got raised on by grandma. Because grandma
it's
did
funny.
it the best.
My grandma taught me everything about cooking and baking, and you're absolutely right. When something tastes like something she made, that to me is just you hold on to it, right?
Absolutely.
So, Dr. D, I also want to mention Dr. Del Rosso has a fabulous podcast called Derms and Conditions, which I must tell you,
I love that.
is the best name for a podcast of any podcast in the history of podcasting. That is, I don't know who came up with that name, but it is fantastic. And I love it. And you interview other dermatologists. You talk within your group of dermatologists. All kinds of issues come up. It's such a great podcast. So definitely check that out, guys.
We have a couple of things we hold on to as far as what's acceptable to us. We don't script it. Right. Even if it's sponsored, you know, we know what the topic is, but we have a real world discussion. Right. And really have a discussion from myself and a dermatologist about the issues that we think are important. And it can be not only on treatments, it could be a variety of other things. Right. How to talk to patients. But it's got to be true discussion. It can't be somebody saying, oh, read the script, don't do this. There may be things they don't want you to include for whatever reason because they don't have approval of a drug or whatever. We'll respect that.
Sure.
But we have an open discussion. If they want to send a script, then we don't do it.
Right.
Can I ask this may be a question just to set the tone here, Dr. D, but have you ever walked into your office and you see somebody sitting there who has a condition that's so bad you don't want to look at it or have to walk out of the room? Does anything stun you?
Well, there are things that you're like, wow, but nothing like you just, it's like the worst case that I've ever seen before or something, but nothing that makes me like, oh my God, I can't look at that. You know, I have trouble with certain smells, right? certain like, you open up a cyst and it's foul smelling, and stuff like that. But it doesn't make me not want to take care of the patient. Probably one of the strangest things I saw was as a resident, you know, I trained, I was at this one office, had a great trainer. He eventually moved out to Torrance, California. He's retired now, Dave Horowitz. He was an unbelievable clinical dermatologist. I learned so much from him. He was just a very, very likable guy too. And so there was a patient that came in, and the waiting room was kind of small and it was always crowded. And so I went in the room, and it was an older guy, probably in his mid to late 60s, and I'm saying that realizing that's what I am. So, I guess I'm an older guy now. But he was sitting there. He wasn't very communicative, um, and there happened to be somebody with him, but I didn't realize it. That was an escort that drove him over from this home where he lived.
Mm-hmm.
And I'm looking at him, and he had all this like brown little particulate things all over, and you couldn't really tell what they were. I looked at them close, and they're moving.
Oh!
And he had lice,
Oh!
but he
Oh.
he must have been having it for so long and in a place where he didn't communicate much, he didn't say much, and nobody really looked at it close enough to realize he must have had lice that was going on for so long that he didn't tell anybody about. He was totally
my gosh.
infested with lice.
Oh my gosh.
And that was probably one of the things that was really the most dramatic, because there wasn't anywhere that you could look in his scalp, anywhere he had hair, chest hair, any place else you could imagine, because they latch on to the hairs, right?
I'd have to go home and take 10 showers after that.
Right.
Like
Yeah,
I'd
and
be
the shower's not going to be enough. I mean, we got him
No.
treated, but I was thinking about it. So I was thinking,
Poor guy.
I didn't
Oh.
hear any screams from the waiting room. So there was nobody that was sitting next to him that was actually
Jen,
took a
you
look,
started
and-
all of this.
Right?
I wanted
Right?
to
You
talk
started
about
all this.
anti-aging,
Well-
and Jen's like, "What's the grossest thing you've ever seen?"
You know, when I was a young girl before the radio, but well, I mean, I'm a radio brat, so I love this job. I love podcast. I love all of this, but there was a moment when I played with the idea of being a PA, being a physician's assistant, because I love medical stuff and I love that field. And I started going through some classes with my friend who was going through nursing school. So I did, some of the prerequisite class, and I loved it. But then I started thinking like, gosh, could I really handle some of the worst case scenarios? And I don't know, you're a girl, you go to the gynecologist, you're like, I wonder if this guy's like ever had a day where he just wishes he had gone into cardiology, like
Well,
is it ever
let me
so
tell
bad?
you, probably the another case that I saw that I really was so happy to help this young woman happened to be in the vaginal area, and she had a disease that had gotten so bad. It's called hidradenitis. So you get these abscesses and inflammation.
Oh.
It had gotten so bad that everything was swollen. You couldn't see, touch,
gosh.
or move anything, because it was so swollen and inflamed, and she just was not getting adequately treated. And I had she was extremely nice. She was extremely reliable. She had just gotten married, could never have what you would typically think would be the first night, right, on your honeymoon. Nowhere near anything like that, because she was in so much pain.
Oh.
And her husband was a great guy. I met him. And so I worked her through all this treatment and got her some treatments that were not necessarily approved, but we knew could help her. I communicated with a dermatologist I knew in Hershey, Pennsylvania, Jocelyn Kirby, who happens to be very well versed with that disease. I had seen it, but not as many as her or as severe. And the woman was fine with me sending a picture, and sending Jocelyn a picture. It said, that's easily one of the worst cases I've ever seen.
Wow.
And we walked through it, and we got her dramatically better.
Oh, good.
And
Wow.
it changed her life.
Sure. Can you imagine?
Significantly changed, but the pain. She said the pain was, and it was so dramatic. It was so much worse
Wow.
than any case. Structurally, you couldn't make what anything was, because everything was so swollen, right?
Wow.
And
Unbelievable.
that makes a big difference when you have those kind of cases. You really
to
want
be able
make
to
a
change
difference for those
someone's
people,
life, which
right?
is what you did,
Right.
to be
Right.
able to
And
do that is incredible.
I mean, guys come in and they have just a tiny little red scale on their scrotum or on their penis. You think the world is coming upon, and you look at it, you could hardly see what they're.
Ugh.
You could. I shouldn't say that could hardly see their genitalia. Yes, you could see their genitalia. You could hardly see what they're coming in about. It's a big deal to them because it's on that part of their body. It's just very
Yeah.
frightening. She was very well composed, but was obviously very much affected by it.
Sure.
And took us about a year and a half through working through all kinds of things.
Wow. Poor
And
thing.
it changed her life.
You're bringing up a good point, because
but if I would have, I'm sorry to
No,
no,
go
I'm
ahead.
not sorry to interrupt because you're interviewing me. Sorry to interrupt, right? But if when she would have disrobed or whatever, and I looked at it, I would have had a face of shock because it was shocking, even with
Right.
all the other cases I've seen in my career. But I'm certainly not going to, like, I had a medical student one time that a patient said they had a certain disease, and the medical student goes, "Wow, cool." And I'm like, you don't say that in
Oh,
front of a patient. But they were thinking, "Oh,
Scientifically,
I
yeah,
just studied
right.
about this. Cool, I get to
sure.
see it."
Yeah,
It's not cool for that patient,
sure.
right?
Yeah.
Like during
It's so important to
surgery,
remember that
right?
too
It
when you're
is,
a
right?
doctor, to remember it's not easy and it's not just a case in the book, it's
Right.
real life
Yeah.
for
It's a real
people.
life. But I understood it,
Yeah.
but I said, you don't do that.
Yeah.
Just like during a surgery, if the patient's awake, and if you just happen to cut the sutures a little bit longer than you're supposed to as a student or an intern, it doesn't hurt anybody. You can adjust it. But if you say, oops, that doesn't sound very good to that patient, right?
No.
During a surgery, oh, I've never seen that before. You just don't say things like that.
No.
Or where did my sponge go? Like
Yeah,
that's not a good one either. No.
exactly. No,
But it is a
where
good
was that
reminder.
scalpel?
It is
Yeah.
it
Yeah.
is a good reminder that dermatology is so much more than the face and anti-aging and fillers and Botox and all these other things. I mean, these are real life, very complicated cases. And I always say I'm fair skinned, as you can see, Dr. D. Jen and I both have a lot of Irish in us, so we've got the Irish fair skin, and when you do a skin check for skin cancer, you've got to get into the scalp, you've got to get into every crevice, everything matters.
You have to
You
look
can't
at
just look
all.
at everything.
You can't just be looking at the exposed
Right,
areas,
right.
right?
Mm-hmm.
You have to be looking, especially melanomas, which can be very
Yes.
serious, are often in areas that have not been sun exposed. But any type of skin condition can, and if you don't look, you're not going to see it. So you're exactly right.
And if you, I also, I had a skin check with a dermatologist not that long ago, and he wasn't the most thorough. And I actually kind of started pointing stuff out. I was like, no, I want you to look at this and then check this. And so you have to kind of really be your own health advocate in, whether it's
You do.
dermatology, skin checks. Yeah.
If you like that particular person and you realize that maybe it's just not the day that they would have the time to do it, you could say to them, "Look, I can see you're pressured for time. Can we schedule a time when you
That's
can
great.
step back and be
Yeah.
more thorough? Because I really
Of
do want a
course.
thorough skin exam."
Of course,
right?
absolutely.
Or you can decide to go to somebody else.
Yeah. So speaking of derms and conditions, which again, I just am obsessed with the name of your podcast. One of the conditions that Jen and I have talked about is, and again, going back to the fair Irish skin, we have a lot of redness. And
I have a lot of redness. Like Victoria has this beautiful skin she's showing you. I really feel like I have to put makeup on every day.
I do have makeup on
because
but...
you do? See, you look so
Oh,
good.
thanks.
Okay. So it looks natural, but you get that my redness in my cheeks, and I've had this since I was a kid, where anytime cold, heat, anything, you're seeing it in my cheeks. And I know I get self-conscious about it, so I constantly am covering it up. People, when they see me, go, "Oh, it's beautiful skin," but to me, it feels like it's too red or pink. What's going on?
Well, some of it is constitutional to people with certain skin types. People with fair skin, some of them will have a certain amount of constitutional redness. If you go to Ireland, which I've been, and Ireland's a great place, and people in Ireland are really about enjoying themselves and having a good time. Most of them that I met, and people will equate it with, oh, you're flushing, so you're drinking a lot of alcohol. That's not necessarily the case, though alcohol can cause flushing. It can cause it's not that. It's not oh, that person drinks a lot, that's why their skin is red. It could be constitutional, but also sun exposure. And you hear this ad nauseum from dermatologists: protect yourself from the sun. And that's not only using a sunscreen, but or a sunblock, trying to, photo protect as much as you can. Over time, one of the changes that's going to happen is dilation of blood vessels in the skin that become larger. So you almost get more of a rouge component to that, but you'll also see those lines, right? Those
Right.
little red lines that become more prominent. And once that happens and they become fixed, they're there. Now, if it's fluctuating, right? If, the temperature can cause in and of itself, when your body is trying to conserve heat, right? The blood vessels and the skin are going to constrict because you're trying to conserve heat and get more blood flow so that your core body temperature, you try and basically all these things happen to maintain your body in the healthy way it's supposed to be. But there are situations where your body's trying to lose heat. You're overheating, so the blood vessels in the skin dilate because they're trying to cast that warm blood, the heat from that, out into the environment. So some of that is natural fluctuation, but there are conditions where you can just have fluctuations for reasons that you don't completely understand, like a condition like rosacea, which some people with rosacea will get, quote, pimples. They'll get red bumps and pus bumps that will come up. But, fundamental to that is that over time, they develop these vasodilation, these flushing episodes that periodically happen if they're, maybe drinking wine, or they're going out, they're exercising, or they're going out into a hot environment or whatever, or even spicy foods. For some people, they'll have triggers that'll cause them to get more red. And that happens repeatedly over time. And as that happens repeatedly over time, more blood vessels form superficially in the skin, and some of them get bigger. So your cheeks start getting redder and redder. Or I'm hearing my English teacher from high school, Mrs. Orban. Is it more red or is it redder? I don't know.
Redder.
But
I was an English major.
Redder?
I'm
okay, English major.
Yeah.
Thank you. Redder, and then we'll put the non-obligatory comma after, and then say that, it gets redder. Yeah. But over time, that becomes more fixed. So the baseline state of your cheeks is more red. So when it first starts, let's say you're 20, 22, usually you start 25, you'll flush like that, and then it goes down, it looks normal. But now you're 35 and you go, I'm more red away. Because over time, that condition has increased the blood vessels in the skin. You can't get rid of that. Well, most of the fix for that is going to be either some type of device light treatment or laser treatment that has to be done by a skilled person and get it under control, and then do that periodically. There is topical medication that can constrict those vessels, but you have to put it, it's only going to last like 6 to 8 hours. Right.
Interesting.
Right. So if I was single and I was going to be going out on a date with J-Lo in about 4 hours or 5 hours, or someone, Gwen Stefani or somebody like that, or of course my beautiful wife before we got married.
Her too.
Get prepared for that, because that's important. I might put it on because I want my face to be less red, but that's not really the way it's designed. It's designed to put it on all the time to keep that redness out, but that needs to be repeatedly applied, right? And so there are some treatments, but redness, it's hard to cover redness up cosmetically.
Yeah.
Yep.
Right?
It is.
The cosmetics that have the green tint and all that. I mean, it's very, very hard without putting on a thick layer.
Yeah, it doesn't look
that you
good.
have to chisel off at night.
Right. I find that because I've asked a lot of dermatologists, because I have a lot of redness too, but it's all over. It's not rosacea. It's just, I get it from my mom, who doesn't drink at all.
It's your constitutional redness. Right. And rosacea is not necessarily alcohol. It's just that alcohol can cause flushing, and people equate it with that. Right?
Yeah, but I've been told that laser treatments are pretty much the only thing that can really make a serious impact.
And certain ones, and done properly, can reduce it. But you also have to be careful, because a certain amount of pink is normal. You don't want to go goth, where you look like a white tablecloth.
No, you don't want to look dead. You definitely
don't want
to
look dead. You
need some blood flow, some circulation.
It's a certain amount is normal, but it's a hard thing to cover up with makeup. And a lot of the cosmeceuticals and the products that are directed against redness, there are many things they're helpful for. Antioxidant effect to help with sun protection and anti-aging, and maybe even reducing skin cancer, in addition to just general sun protection. And that's true of anybody, not just lighter skin individuals. Dark skin individuals also need that protection.
Absolutely,
right? They certainly, everybody does. But redness is the one area where they're not quite as good as the cosmeceuticals that you buy without a prescription, right? It's harder to control redness.
When it comes to sun protection, I have to know, like, I have various doctors, my my general practitioner. I've had other doctors that have come through, and they say that you need that if your vitamin D levels are low, and a lot of Americans suffer with low vitamin D levels, that you should give yourself 10 or 15 minutes in the sun without SPF or sun protection. Do you find that to be true, Dr. D, or do we always need to have sun protection on no matter what?
I think that nobody knows where
Anything.
and I also don't know that we know exactly how to figure out when people are vitamin D deficient, but I certainly think that may be the case. But the data that I'm aware of, and some very good scientific data, is even with sun protection, if you're outdoors, you will get some vitamin D production from the sun, but nobody can tell you how long is okay and how long to repeatedly do it.
Because everyone's different too.
I seriously doubt that everybody's programming their smartwatch or whatever to tell them, oh my God, I just was out 15 minutes. I need to run in the house right now.
Right.
You're talking to your neighbor, or you're doing something, you're getting 20 minutes, 25 minutes, 30 minutes.
Yeah.
So the easiest way to do it is to do what I do. I take 1,000 international units of vitamin D a day, and I don't have to be concerned about it, right? And so it's a very easy fix, so that you don't have to play roulette versus how much sun should I be getting, because
Smart.
the sun damage, photo damage from the sun or ultraviolet light and other bands of light is what contributes to greater increase of skin cancer development, but also changes within the skin that people are not going to like what it looks like later. And that's going to vary from person to person.
What should we be looking at when we're looking for signs of skin cancer, if we're giving ourselves a check and we're looking? I know if a new dot comes up, a new spot, but is there something that we should be looking for that might indicate a deeper dive into whether or not it's a skin cancer?
Well, if you have an area on the skin that tends to open up and bleed a little bit easily, not something you're picking at, where you're obviously causing that, but you'll notice an area and then it heals up and it comes back again. That may be a sign that in that particular area you're having a change that might be an early sign of a skin cancer. That's a possibility. Any new growth that seems to be changing, and it doesn't have to be an overnight change. Certainly a quick development of something, you want it looked at, because there are some serious conditions that can happen quickly. But you basically have to first of all become familiar with your skin. And so you have to know, be familiar with yourself, or glance at yourself, or have somebody that cares enough to do it, because it's interesting how unaware people are.
Sure.
They'll tell you, say, how long is there? They have no idea. They're really not aware, right? There was an interesting study done some years back, and I don't remember exactly what year it was, but it was patients that came in that had abnormal moles, where they found out that they were severely abnormal under the microscope when they were removed, or they were already cancerous. And they were found on self-examination or by someone, a significant other, a wife, a husband, boyfriend, that's seeing you thoroughly enough and naked enough that they're familiar with parts of your body, not just the face or area that anybody can see. And it was interesting that in no case did a male point out a spot on a female, a woman, that drove her to go in. Now, this was years ago. I think awareness might be different now. And, is that because they're not really paying attention and they're watching the football game or whatever, the typical stereotype of the male? All the cases that were found were a woman noticing it on a man, right? And
I'm not surprised.
I think back, well, I'm not surprised, but you think back to magazines, there's lots of magazines out there. Health is driven by teaching women, right?
Absolutely.
And it may
Mhm.
be a beauty magazine, or how to make yourself look sexier, or how to prevent aging, but there's a lot of health articles in those women's magazines.
Mm-hmm.
Field and Stream or Rifleman or car
Horse and
magazines, right?
Hound,
Right,
name them
right.
all.
Yeah.
They don't have a lot of articles in there about men's health,
It's true.
but it has improved. It's improved dramatically.
That's
More
good.
men are being educated, but for a long time, most of the patients that come in, that or somebody else suggests they come in, I'd have to say easily 90% of them are men saying that my girlfriend or my wife said I needed to
Something
come
looks,
in, right?
fishy.
In fact,
Yeah.
sometimes they circle the spots on them
That's
with
good.
a
That's a
marker,
good plan,
right?
actually.
Have them look at this one,
Smart.
have them look at that one. But it's getting better, and I think it's really important. I think more and more men are becoming more health aware, and there are men's health magazines, and better diets, and people are paying a lot more attention. But it's taken longer,
Yeah,
right? Women drive healthcare in the United
for
States.
sure.
For
They
sure.
really do.
Absolutely.
They really do.
And Jen, you had an interesting question for Dr. D about, and this every once in a while happens to me. We get,
Mhm.
I would assume it's a hormonal pimple or pimples that we get or that coincide with menstruation. And they always seem to pop up in the same exact place. What
Yeah.
is the reason for that?
And I
Like
I
I
don't
always get
know
one
that
right on my chin. It's the same spot that's
Always.
right on the chin.
I get one zit every month. It's always during that certain time, and it's in the same spot.
we all have an Achilles heel. Some people, they get stomach upset. Some people, they get a headache. You get that zit. And,
Just one.
I've never menstruated that I'm aware of,
It's good to
in a
know.
previous life or whatever. But I would imagine that it's not really the most fun or comfortable thing in the world. There's a lot of hormonal fluctuation and perimenstrual flares, around periods of before. And women that have their period, they menstruate pretty much the same time each month, know it's coming. They could feel it coming.
Yeah.
Right.
Mhm.
They could
You
feel
it
coming.
underneath, like at a much
You-
lower
it-
level of the skin,
it's-
and then it
It's
eventually.
like Mount Vesuvius is erupting.
Right.
It's not a little tiny pimple.
It's like a
A
boil.
lot of times they're tender, right? And they come up, and they last a period of time. But why they're in the same place, I don't know that we exactly know. Now, it's hard to control that with just utilizing intermittent treatments. There are some things that people do. I had a friend, it was very instrumental in helping me get into dermatology, that's still in practice. A guy by the name of Eugene Conti. We went to college together. He was a bio major. I was a pharmacy major at St. John's in Queens, New York. And he did something that he said, a lot of people are just, they're going to say this is heresy. But for those women, I give them about 5 days of a little bit of oral prednisone, right?
Oh,
Cortisone.
steroid.
Oh,
Okay.
interesting.
And it blocks it. And they only
Yeah.
do that. I think it was like 5 days a month. He said, I know I'm going to be criticized. Oh my God, you're giving them cortisone. But
But don't
helped
you
a
get
lot
an
of those
injection?
people.
Like if it gets bad enough, isn't that
If
what,
you get a
right?
deep enough acne lesion that is deep enough and inflamed
For an injection,
enough,
it's the same
right?
medicine,
Right,
isn't it?
you can get an intralesional injection, but that doesn't even only have to be perimenstrual. Those are people
Sure.
that occasionally get their intralesional injection, but
Mhm.
some of them are not big enough to do that.
Mhm.
And one of the problems with the intralesional injection, it could overcorrect, and you can get an area that's overcorrected and divoted a little bit.
Oh.
But
Okay.
so it has to be a deep enough and thick enough lesion to inject. Some people will give them, topical to start putting on, but even pyridoxine, vitamin B6, people have published inconsistent, right? Whether it works or not. But in my view, it's not going to hurt you, right? So, give it a try. Maybe it works in your case, right?
What about as far as products and advancements? Like if you're just looking through your particular specialty in dermatology, is there a product or an advancement where you're like, oh yeah, now we're really doing it right? Is there something that kind of is your go-to or something that you feel like might have revolutionized dermatology?
Well, dermatology is being revolutionized for certain disease states where we didn't have a lot of treatments that really worked well. So you'd almost feel bad going in the room because, yes, you wanted to help people. You were supportive. You did what you could, but you had limited options, knowing that many of these things don't work very well, or ones that may work better have a lot of potential toxicities. So you have to monitor side effects and get blood tests. We have major revolutions, advancements that have really been, I'm not a buzzword person, but they are game changers, right?
Yeah.
Like everybody's like, "Oh, that's amazing. Everything's so amazing that nothing's amazing anymore." We keep hearing that same term. Don't tell me I'm amazing, because then I'm like everybody else, because everybody's saying, "Oh, you're amazing. Well, that's amazing."
Before we started, like calling everybody a legend, right? You have to save the words for what they really reply
to be a musician that's a legend, you had to be around for 7 or 8 years and had at least 10, 12 contributions on a consistent basis, not just one big hit. But anyway, that's the Jim Del Rosso view, which means it's right, but not everybody necessarily agrees with it. But what were we talking about?
Advancements. What's something that has really excited you personally?
Well, I'm excited by all of these things, because now when people come in with diffuse psoriasis, they come in with atopic dermatitis, eczema, itchy rashes that have been having repeatedly. They come in with alopecia areata, where they've lost a lot of hair because it's autoimmune, right? Even vitiligo, where they have the white spots on their skin, right? Hidradenitis, which I explained was that woman that came in, that could be under the arms and the groin area, on the breasts, and even other areas with these recurrent abscesses or boils, and then they lead to scarring and create chronic problems over time. We have made so many advances, some of them with injectable biologics, which we've gotten some that are very, very effective and overall very, very safe, though you always have to know what things to look for. Even some oral treatments that we have now, called Janus kinase inhibitors, which can carry some baggage depending on which ones they are in terms of monitoring. But the things we had before had as much, if not worse, in terms of treatment, with less data to support them. So we are changing people's lives. For example, psoriasis, they're covered 70, 80% of their body. And we're turning people around within a matter of a few months. Sometimes it takes longer to have almost nothing and can sustain it.
Isn't that incredible when you see those cases?
But people get concerned. Oh, I'm injecting something. How's it affecting my immune system? Well, your immune system is dysregulated, which is why you have the disease. If it was in balance, you wouldn't. So you're trying to target where it's dysregulated as best as you can. You're not coming in with something that's in balance. If it was in balance, you wouldn't have the condition. Right. So people have to work with that, and you go to a good clinician, they'll help you walk through it and help you make the best decision. Right. But you see people now and you feel good about it, where before is like, I wish I had more to help them, but I really don't. Right.
Mm-hmm.
Alopecia areata, where people lose a lot of hair,
so sad.
And we can turn a lot of those people around to get excellent amount of hair regrowth.
That's incredible, right? And and a lot of I credit a lot of celebrities. Jada Pinkett Smith, of course, has been very vocal about her recent development of alopecia. I'm not exactly sure which type of alopecia she has.
Alopecia areata is the one that we're talking, which is a specific immunologic based one.
It's so and Kim Kardashian apparently has psoriasis all over her entire body, which you would never know because she's always naked. But she has talked often.
I'm not sure exactly. I did see a picture of her having psoriasis on her leg, but I will give a call out. I'll give a call out to Mattel. The Mattel, has Barbie dolls.
Yeah. They did that.
They have recently put out 2 Barbie dolls, right? I'm holding them here because a friend of mine told me about them and sent them to me as gifts. I'm holding the one that's vitiligo Barbie. And it happens to be a black woman. Now, anybody can get vitiligo, but the contrast...
That's the one where you have the white patches, right?
Right.
So,
the contrast
Winnie
in
Harlow,
darker skin. Right. She's an example of that. But not everybody's a Winnie Harlow that, with that comfort level with it. That I'm sure what she went through, but she's used it in a very positive way to
Yes.
help. But this doll, you're looking at it, and it happens to be a black woman to show the contrast, and they're selling it, right? And
Yeah.
so if you have this, especially if you're like a younger person, a little girl,
Mm-hmm.
Makes a
it's like, well,
difference.
this is, I'm not as odd or as outcast as you think. There are other people
Mm-hmm.
that have it. The alopecia areata one, they have, the woman is totally bald, right? She's totally bald. And I'm told that from a friend of mine, Natasha Mezenkosko, who's a great dermatologist in Orange County, that does a lot with treatment, with some of these newer treatments, and does a lot of alopecia areata research and treatment. She told me that the National Alopecia Areata Foundation, that is a patient organization that they could join. The patients can sign up and join. That, I guess, certain age group, and I don't know if they send the doll to boys. I really don't know, but they do send them to children
That's wonderful.
free
That's
when they
wonderful.
Yeah.
sign up to be a part of that organization. So you're sort of getting it, thinking, maybe I'm not, as outcast. Maybe, you know,
Makes you feel more
it's
normal.
within
Absolutely.
it's
Yeah.
within a range of what happens to enough people. It makes people feel good because, a lot of these diseases, the data on vitiligo, and, we don't always have time when patients come in the office to drill down on every way that it affects them, how they interact with themselves or their family, or even some of the social issues or cultural issues with certain cultures. If somebody has it, they're dealing with a lot of psychosocial issues that we don't even necessarily get a chance to touch upon until we do a study and we get that information, right? In a normal doctor's office visit, you can't go through A to Z, or there's not time to go through A to Z of how that redness affects you when you don't want to go to work that day. It's flared up
Right.
and you don't want to go to the office, right? Or you go, how you think someone's perceiving you, that you're hoping asks you out, or getting a job. I mean, all these things go through people's heads, right?
Yeah.
But they don't necessarily tell us all of that, right? So it's nice if we could make people feel better about themselves,
Mm-hmm.
um, even though they have something that's affecting their skin, right?
Yeah.
For sure.
So Dr. D, I have a question. We'll change gears for 1 second. It's a potentially controversial.
Jennifer, second's over, isn't it?
I
She
think a
said 1
second's over.
second.
You can
Second's
write that
over.
down.
Okay.
There's mine. Mark it. There's my mistake. So here's a potentially controversial question. And I say controversial in the sense that many, many different opinions from dermatologists to scientists, researchers, and the beauty industry, right? And the topic is parabens. I've heard every different opinion on this. Parabens are great. Parabens are awful. Parabens cause cancer. Parabens don't cause cancer. Where do you stand on parabens, which are in a lot of cosmetics and skincare, whether it's serums or moisturizers or even beauty products, for it's a preservative. So what's your take on, should we be all against parabens or somewhere in the middle?
What I have read and my experience with products that contain parabens has been that parabens, it's uncommon for them to create skin allergy. They can, right? And a lot of things become recycled dogma. It appears someplace in an article or a textbook, and the next edition it just keeps getting recycled forward. And then you try to go back and find that original reference, and you go, "Oh, that's what this was based on." There's
Mm-hmm.
not a lot of evidence
It's
here.
like the
In the
game of
case of
telephone.
parabens,
Yeah.
yeah, well, yeah, right. But it's whether there was even not even the game of telephone. The original reference was weak,
Mm-hmm.
but it got carried
Right.
off because a lot of medicine was practiced based on a group of leading dermatologists saying things at the podium, and that became the reference.
Mm.
Now we want a lot more data, a lot more studies, and there are studies. You have to make sure they're good studies. Not everything in print is necessarily of high quality, right?
Sure.
But with parabens, we have enough experience and enough use to know that most people will use parabens and they're not going to have any problem with them on their skin. As far as their internal toxicity, I think that the information that we have based on exposure that people get from topical products, I don't think creates a problem.
Okay.
I do think in certain laboratory testing, right, there's many things that if you give
Ingest
high
them
amounts
or
to a
whatever.
laboratory rat
Right.
could create a problem. Many
Right.
things that but parabens are not one in my mind
Yeah.
that has hit a level that I'm really concerned about paraben. People would ask about it if they would prefer something that's paraben free. Then we try to find them a product that is paraben free. But I don't have that concern about parabens, and I don't think in our common use that we can relate it to forming any kind of cancer. But in reality, how do we know that many of the things we do are a problem or not? We don't. But I think that these groups that put these labels go too far the other way. So parabens are not one that I'm particularly concerned about. That's my opinion.
I'm happy you said that, because the reason we ask is our listeners, what Jen and I do on Beauty Pop, we review products. We're beauty junkies. We love buying skincare lines. We love all of it. And there is such a movement right now marketed towards women that's clean beauty. And it's such a buzzword that has no real meaning or depth to it.
It means nothing. It might use something that's natural. Arsenic's natural. Poison ivy is natural.
Exactly.
Foxglove is natural.
They're not
right?
Great.
So I mean, there's these buzz phrases. I think that's marketing to sell products.
Yeah,
absolutely.
That's personal.
Right.
A lot of the companies that promote over-the-counter products can say a lot of things without backing them up and come up with marketing buzz phrases, right? That people run to, right? And that there's not a lot of substance. That being said, I'm not saying that things that they're including and things that they're doing aren't positive, but I really don't know what clean beauty means.
No one does.
Right?
That's why people fall for it.
You follow the crowd, you're probably making the wrong decision.
This is true.
There's a lot of very intelligent people that said that. Sort of think for yourself, right?
Don't be a lemming.
But I'm not knocking companies that have. There are some that have. I could think of some companies that really select products a certain way and have some very good products. And
share some brand names if you want. We name check. If there's anything you like.
There's a variety of good products, but it doesn't mean that they're saying that clean beauty that they don't have good products. But I think that a lot of companies are more concerned about marketing to make a buck.
Yes.
Right. That drives a lot of the decision making, as opposed to let's make sure that we've scientifically proved all of this and then we'll talk about it. So I get really concerned about buzz phrases. I really do. And
especially as women, it's all aimed at us constantly, and it's tough without a medical degree.
If they can get you to get a small bottle and spend $150 on it for an eighth of an ounce, they're going to do it.
Yeah, absolutely.
Some people, I could get criticized, but that definitely exists. There's overstatement of a lot of things.
Dr. Del Rosso, we thank you so much. I mean, this has been so fantastic. I hope you'll come back maybe and do this again with us if we can. I know that there are going to be a lot of questions from the folks that listen, some of the ladies that listen to this podcast.
You don't have any men listening?
We'll have more questions. I think too.
Couple?
There's a couple. You're going to be listening.
So you're just
we snatched you.
Quickly kicking my butt off when we were just getting started. But,
we want you to come back for sure. And we so appreciate you. By the way, if you want to send a question in, we'll have Dr. D back again. You can do it. Just send us an Instagram message. You can find us Beauty Pop Pod, On Air Victoria, Jennifer Horn Radio, and let us know if you have any questions at all. I think Dr. D, we can twist his arm and have him come back.
I'd be happy to come back and talk to you later.
I think Jen and I are always threatening to go to Vegas to have a girls' weekend. I think we just need to do Vegas and have Dr. D hang out with us.
I'm 4 hours away, baby. Let's go right now. We're going to go to the Bootlegger for Italian food. I like it.
Yeah. Have you heard of, you're not talking about brand name plugs, but have you heard of JSX Airlines?
Oh, is that the private plane?
That's the private plane, but
haven't tried
it's not chartering. I did it for the first time. Somebody recommended it. You book it like you would a commercial airline, but it's at the private airport. So there's none of the TSA. You go through.
Awesome.
The trip that I took, right, to happen to be to Burbank
Yeah,
was
that's right where
maybe
I'd leave.
$75 more than what it would have been if I looked up at the commercial airlines for that particular
That's
day.
fantastic.
And you just walk right on, and you don't go through all the TSA and all the hassle.
Let's book it.
I don't know what it's. I really loved it. So I'm always going to check them first. And they don't go everywhere, but they go like Orange County, San Francisco, I think Oakland, maybe Phoenix, LA, Burbank. I like flying into Burbank more than LAX. No
Me
offense,
too.
but
That's my home airport because not only is it quicker and easier, it's a lot closer to home for me too. But that's a travel tip for you from us
just
here
look up
at Beauty
look
Pop.
up JSX. I have no conflict with them. I don't have any financial relationship with them other than if I can avoid TSA and all the crowds and all the hassles at the airport, I will do it.
Sign me up. Keep my shoes on, please.
Exactly.
Dr. Jim Del Rosso, thank you so much for being with us. Thank you all for listening as well. Again, give us a like if you can on Beauty Pop Pod. Send us your questions there on Air Victoria Jennifer Horn Radio. And please, if you have a moment, give us a review. Tell us that you like the podcast, what you like about it. That really does help with how we are listed. And we can't wait to talk to you again next week. Thanks for listening.
And if you want to rip Jim Del Rosso apart, I got thick skin. I'm from Brooklyn.
And don't forget, check out Derms and Conditions, which is a fabulous podcast that Dr. D hosts. So thank you again, Dr. D. It has been such a pleasure having you on Beauty Pop. And thank you guys for listening, and we will talk to you next week.